Radiation therapy. Okay, I know those words can sound a little intense, maybe even a bit scary. But what if I told you it's actually one of the smartest, most precise weapons we have in the fight against cancer? Today, we're going to pull back the curtain and really demystify how this whole thing works.
So this is the big question, right? It's the one that's on everyone's mind. We're talking about a powerful beam of energy, so how on earth does it know the difference between a cancer cell and the perfectly healthy one right next door? Well, the answer is pretty fascinating, and it's probably not what you're thinking.
All right, so here's the first big secret. The radiation beam itself, it isn't intelligent at all. It's just energy. It can't tell a good cell from a bad cell any more than a flashlight beam can. The real smarts behind the whole operation come from two things: how we aim that beam, and, this is the big one, how we exploit the biology of the cells themselves. To outsmart cancer, doctors use this incredible three-part playbook. First, you've got geometry, which is all about the super precise mapping and aiming of the beams. Second, and this is the absolute core of the strategy, is biology, using a critical weakness that's baked right into every cancer cell. And sometimes there's a third part, chemistry, using drugs to make tumors more sensitive. But for now, we're going to focus on those first two.
This brings us to the most brilliant part of the whole strategy. At the end of the day, it all comes down to a tale of two very different kinds of cells and what happens to them after they get hit by a dose of radiation. This is our biological secret weapon.
So check this out. Radiation works by damaging the DNA. You know, the instruction manual inside all the cells it hits. But here's the crucial difference. Your healthy cells are like master mechanics. They have these amazing, robust DNA repair kits, and they get to work fixing that damage right away. Cancer cells? Well, they're a chaotic mess. Their internal repair kits are basically broken. They are just terrible at fixing themselves. And we exploit that gap.
So how do we exploit that repair gap? With a genius strategy called fractionation. This was a breakthrough discovered way back in 1911. Instead of hitting the tumor with one giant dose, we break it up into small, daily treatments, or fractions, spread out over weeks. Every day we hit both the healthy cells and the cancer cells. And every night, your amazing healthy cells spend the next 24 hours repairing themselves, good as new. But the cancer cells, they just fall further and further behind until that damage builds up and becomes lethal. It's brilliant.
Okay, so now we get the biological why. So let's talk about the procedural how. Because before a single beam is ever turned on, there's an incredible amount of planning, basically mapping the entire battlefield inside the body.
This whole process is called the simulation. First, you get a CT scan that creates the super detailed 3D map of your tumor and all the healthy organs around it. Then, they place these tiny little tattoo dots on your skin. Think of them like GPS coordinates that let the machine line up perfectly every single time. And finally, they create custom molds or masks that hold you perfectly still, ensuring you're in the exact same position down to the millimeter every single day. It's all about that precision.
And this is that geometry piece we mentioned earlier. It's kind of like having multiple spotlights in a theater all pointing at one actor on stage. Each individual beam of light isn't that strong on its own, but that one spot where they all overlap, it's brilliantly lit. It's the exact same idea with radiation. The tumor, sitting right at that intersection point, gets the full 100% dose, while all the healthy tissue around it just gets a small fraction from the beams as they pass through.
Okay, now let's talk about something that I'm sure is on your mind, side effects. Because even with all this incredible precision, the treatment isn't perfect, and it's really important to understand why side effects happen and what to expect. So the most common things you'll see are some fatigue, maybe some skin redness in the area being treated, kind of like a sunburn, and hair loss. But, and this is a huge one, only in the spot where the beam is aimed. This is so important. Radiation is a local treatment. Unlike chemo, it does not cause you to lose all the hair on your body. If you're getting radiation to your prostate, you're not going to lose the hair on your head. That's a myth.
But wait a minute. If the planning is so precise, why are there any side effects at all?
It's because that beam still has to travel through healthy tissue to get to its target. And the healthy cells that tend to get irritated first are the ones that also happen to grow and divide pretty quickly, like your skin cells. They get caught in the crossfire, so to speak. But here's the good news. Because the repair kits are working overtime, most of these effects are temporary and heal up within a few weeks after the treatment is all done.
Now, as amazing as all this is, the story doesn't stop here. Not even close. You see, the field of radiation therapy has been innovating for over a century, and the progress we're seeing right now is it's truly unbelievable.
I mean, just look at this journey. It all started way back in 1895 with the discovery of X-rays.
Then that biological breakthrough of fractionation in 1911, all the way to today with AI and real-time imaging. This isn't some newfangled idea. It's a field built on a deep, deep foundation of science and just relentless improvement.
And that pace of innovation, it's hitting warp speed. Seriously, the tools that doctors are using today would have been straight-up science fiction just a decade ago.
Take the MR Linac. This incredible machine combines a high-def MRI scanner with a radiation machine. This lets doctors literally watch a tumor move inside a person's body as they breathe, and they can adjust the beam on the fly to stay locked on target. It's like hitting a moving target with pinpoint accuracy.
Then there's something called proton therapy, which is just wow. Unlike a normal X-ray beam that goes all the way through your body, a proton beam can be told to stop at a very specific depth. It deposits all its energy and then just stops. This means there's zero exit dose to the healthy organs behind the tumor. This is an absolute game changer, especially when treating cancers in children.
And now we're bringing in AI. With AI adaptive therapy, the treatment plan isn't just made once. Your body changes day to day. Tumors shrink, organs shift a bit. This technology uses AI to create a completely new, perfectly optimized treatment plan every single day, adapting to the tiny changes that happen in your body over the last 24 hours.
So where do we go from here? What's the next frontier? Well, researchers are working on something that sounds like it's out of a sci-fi movie. It's called flash radiotherapy. The idea is to deliver an entire course of radiation in less than a single second. Early studies suggest this incredibly high dose rate might just vaporize the tumor, while leaving healthy tissue almost completely untouched. It's turning a weeks-long process into a momentary flash of hope. The future is coming fast.